Wounds are something which, as a general surgeon, I see on a daily basis, and for the most part, we expect them to heal quite rapidly within a week or two. But occasionally it takes a lot more effort, and sometimes these wounds last for a long time. And they can be deeply frustrating, both to doctors who take care of these patients, but also the patients.
Diabetic patients with non-healing foot wounds are probably going to be the most common types of patients we're going to be able to assist. In addition, patients with more unusual wounds, such as chronic refractory osteomyelitis, in other words, infections of the bone that have been treated with the usual modalities, intravenous antibiotics, and wound debridements, and these wounds can be very, very difficult to heal. So those would be good patients. Patients that have complications as a result of radiation therapy. So patients that have had cancer and then get radiation treatment, sometimes they can have complications.
Now we have tools which we never had before, which can really change the entire picture, from a wound that will not heal to one which can be healed with new modalities, especially with special wound care techniques and medications, and sometimes grafting, and also in some cases with the application of hyperbaric oxygen. Hyperbaric is not new. It's been around for over 100 years. It is using oxygen, which is in the air around us.
A lot of these wounds we talked about earlier, non-healing wounds, are suffering from lack of sufficient oxygen.
And these circumstances, when you breathe them in, can make a permanent difference in the wounds towards healing, or in the case of radiation bleeding, to stopping the bleeding. And even better, quite often we can effect a cure. And I think that is the most exciting thing of all.